the way I see what's going on is that people are abandoning their traditional desktop and even laptop computers. And they're using these things which are really not computers. They're just windows to a computer that's located somewhere else. The processors in here are not very strong. It's just strong enough to communicate with a real computer that's located somewhere else. So you don't have to carry around a big computer. You're not carrying around much storage. Everything's stored somewhere else. All the processing, all the data is stored, they call it in the cloud. It's really just another real computer that's located in another building somewhere else. And the advantage then is that all of the data is kept for you. You don't have to worry about whether it's secure. You don't have to worry about whether it's backed up. Somebody else is taking care of all of that for you. So all you really have in your iPad or your iPhone is a window to another real computer that's located somewhere else that you don't have to worry about. All the data is safe, all the data is secure. And that's what the iPad app gives to you if you're a chiropractor and you're using, or if you're a doctor of any kind and you're using electronic records. The records are going to be stored for you. All of the data is going to be secure. All of the saving of the data is going to happen automatically. There's no pressing a Command S button to save anymore. You don't worry about that. Everything happens automatically. So that's the way things are going. In a year or two, what will happen is what's beginning to happen now, where you're no longer even typing. You'll do all of your data entry by voice command. You'll tell the computer what's going on with your patient. The computer will automatically convert it into text, and then it will save it, and it will automatically present a report to you at your command. So you won't even have to worry about the fact that right now typing on an iPad and even on an iPhone, it's a little bit cumbersome. It's not what you're used to. But in a year or two, you won't worry about that. You'll just talk, and then you'll get a report back, and you'll tell the computer how to edit the report so that it's all formatted just the way you want it to be, and it will be trivial to do all that. And all the while, all the data will be saved for you. All the data for all of your patients historically will be saved for you on a computer that's located somewhere, probably on your facility, but it might be located somewhere distant. And even if it is located on your facility, there will be a backup somewhere else. So even if the worst catastrophe happens and you lose your server on your facility, there will be a backup somewhere else. Everything will always be safe for you. So that's the why. That's the why behind using an iPad and using an iPad app. Your data will always be secure.